and welcome to Kaweah Delta's online town hall. My name is Deborah Volison, and I'm the Director of Community Engagement here at Kaweah Delta. This is our third town hall in a series of 5, and due to the COVID healthcare crisis, this one looks a little different than the first 2. But one of the things that has not changed is our commitment to transparency. We made a few years ago that commitment, and we want to make sure that we are available to answer any questions that you may have and to hear feedback from you as well. I'm going to be joined tonight by Hawkins, our district board member, and Gary Herbst, our CEO. But before we get started, I just want to go over a few logistical matters regarding tonight's meeting. Several people have submitted questions in advance, and we are going to cover those during this meeting. But our chat feature is going to be live the entire meeting, so feel free to chat at us at any time, and I will try to incorporate your comment or your questions into this discussion. So at this time, I'm going to welcome Herb Hawkins into the room. Herb is the board member representing Zone 1 of our healthcare district. He has served on the Kaweah Delta board since 2015, and he is active in the Audit and Compliance Committee, the Governance and Legislative Affairs Committee, and the Quality Council Committee, as well as several independent committees. Herb, welcome.
Thank you, Debbie. Thank you, Deb. I appreciate that. I'm Herb Hawkins, as Debbie said. I've been, as she said, on the board for about 5 years. There's just a couple of comments, observations that I would like to make. One, when I came on the board, I'd been in the hospital as a patient a couple of times. I had quadruple bypass heart surgery 20-some years ago, and always had excellent care. But one of the things that I have come to realize after being on the board of how really little I knew about Kaweah Delta. And I suspect that many of you out there and citizens of the community are in the same boat. But I must tell you, this is a fabulous institution. The things that are going on, you've heard a lot about the cardiac, the heart, and we've tied in with the Cleveland Clinic, the #1 cardiac facility in the country. We are tied in with Valley Children's Hospital for some time now to offer excellent pediatric care to new mothers and children that need it. We have the lifestyle. I'd like to make a comment on the gym at Lifestyle. And I think that many of you are missing a great opportunity because Lifestyle not only gives physical help and exercise physiologists conducting classes, but there is a myriad of educational things that are put on at that facility, like at noon from 12 to 1, many days of the week, and then at 6 to 7 or 8 in the evening. And I think that we are not taking, I say the people in Visalia, are not taking full advantage of the facilities and the things that Kaweah Delta offers. It's just unbelievable to me of what is being offered by this institution, and I hope that all of you will explore this and take advantage of it. The second thing I would like to comment briefly on is management of Kaweah Delta. I've been a business owner. I have been manager of sizable operations. I've worked with some of the finest people, companies here in the Valley, companies that I think could easily be case studies for the Harvard Graduate School of Business. I've also, I spent most of my career in finance, and after that, I spent 15 years working with small companies in the developing countries in their management, their structure, their marketing, to help them succeed, make more money, hire more people, and contribute to their community. So I think I've had a pretty good observation for a number of years on management in a lot of different situations. I am become totally impressed with the management of Kaweah Delta Hospital. It includes the food service people secretaries, nurses, doctors, exercise physiologists, physical therapists. Across the board, these are dedicated people. The executive team is here to set the example, led by Gary Herbst. And I can't say enough about the executive team leading. It is a total team effort. And I am just totally impressed, and I think we are so fortunate to have Gary and the executive team and the nurses and the doctors and the staff on this hospital for providing health care to all of us in this community. Thank you.
Thank you, Herb. All right, at this time, we're going to bring Gary Herbst, our CEO, in. Thank you, Gary. We appreciate
yes.
you joining us.
All right. Thank you, Deb. Thank you, Herb. I greatly appreciate the words of support and encouragement. They mean a lot to us, particularly during these very challenging times. And I'd just like to welcome all of you tonight to the virtual version of our town hall meeting. Certainly not what we were anticipating when we did our second one back on February 27th over at the College of the Sequoias at one of their classrooms. But I wish we were here together in person, but we're not, but we will very soon, we're hoping. Because of just the environment we're in right now, the condition we're in, I'm going to kind of change things up. Generally, at the first two town hall meetings, I would generally start out, spend maybe 8 to 10 minutes just covering a multitude of different activities, construction projects, different initiatives that are going on at the medical center right now. And then I would launch in to your questions. But right now, while there's still a lot of activities and initiatives going on at Kaweah Delta, there's no doubt about it that we're almost singly focused on the COVID-19 pandemic right now. And so I think tonight, given the questions that we have received in advance, we're pretty much going to dedicate tonight's discussion all about COVID-19 and hopefully to answer all of your questions to help you feel better informed and just have a better sense of what's going on locally at Kaweah Delta. So again, thank you for being here, and just real quickly, just want to give a huge shout out again to our community. The amount of support, the generosity, again, the words of encouragement and support, the multiple donations of masks and gowns and caps and food and money to our employees, our physicians, has really lifted the spirits of our organization. And it's easy to get kind of down during these difficult times, but just the outpouring of support and love from the community has really meant a lot. So thank you for that. All right, Deb.
Okay,
I'm
thank
ready.
you, Gary.
Okay.
Okay, so we always like to start out with numbers. And so I've moved the numbers up to the top.
Okay.
So do you want to discuss numbers? How many patients we have in the hospital right now with COVID-19?
Yeah, sure.
Okay.
Well, let me first give you context. So as of right now, we actually have 319 patients that are in the acute medical center, the downtown hospital. So 319 across our various units. Of those 319, 30 of those patients are positive for COVID-19 and are essentially, that's why they were admitted, it's why they're being treated. 6 of those 30 are in the intensive care unit. Likely, most of them are intubated on a ventilator right now. Another 6 are in the intermediate critical care unit, and then the balance of the 18 are on 2 South. 2 South is normally, under normal conditions, it's a 29-bed, what we call observation unit. So patients that come in, we're not certain whether they need to be admitted or not, but we want to observe them. We want to keep an eye on them, run some tests and so forth. So early on in this pandemic, when we started seeing hospitalizations, we dedicated that 2 South unit to be our COVID unit. So we have staff that are highly trained in treating the COVID virus, that know how to protect themselves and protect their patients and one another. Isolation rooms, it's a negative pressure unit, meaning that the air stays in the room. We have HEPA filters there that are constantly changing the air. So that's kind of our COVID unit. Patients that they still need hospital care, but not quite critical care, that's where we house them.
Okay. How many deaths in Tulare County are attributed to COVID were nursing home patients?
So again, as of this morning, the county publishes their updated numbers every day on their website, and as of this morning, they reported that there have been 71 deaths across the entire county since the inception of this pandemic. 51 of those 71 were residents of nursing care homes here in Tulare County. So roughly 72% of all the deaths that have occurred countywide came from the nursing homes. I think everybody learned first the largest breakout occurred at Redwood Springs, where they had 138 residents that were living in the facility at the time of their outbreak. Virtually all of them became infected, and I think they are accountable for the greatest number of nursing home deaths. Of the 71 that have sadly died in Tulare County, 33 of them actually died here at Kaweah Delta. Many of those 33 were patients from those nursing homes. And sadly, just as early as this morning when we're reporting out 71, we had 2 more deaths that occurred in Tulare County today, so we now stand at 73.
Okay, so of those deaths in Tulare County attributed to COVID, how many had underlying conditions?
Yeah, so I can't, Deb, I can't speak for, those that never came to Kaweah Delta, because I don't think that information has been disclosed by the county or any other hospitals that might have experienced some deaths. But with respect to the 33 that died here, I'd say almost 100% of them had at least one serious comorbidity or chronic condition. And just looking at those 33 deaths, there definitely was some common chronic diseases. The top of the list was chronic renal failure, so patients that their kidneys don't function real well. Heart failure, patients with congestive heart failure, other cardiovascular disease, end-stage renal disease, where a patient's kidneys are no longer functioning at all and they're now on dialysis, usually 3 days a week. Coronary artery disease, chronic obstructive pulmonary disease, diabetes, and obesity are the common comorbidities that we would find in those patients.
Okay. So are we seeing more cases because we're doing more testing?
Yeah, I think we're absolutely. Definitely, testing has become increasingly available over the 2.5 months that we've been fighting this. Kaweah Delta, a little over a month ago, developed its own testing capability running on a couple different platforms. The county continues to test. Sierra View Hospital now has the Abbott ID Now platform, so they're able to do testing. And then the state has established new testing sites in Dinuba and Porterville. So without a doubt, just the more testing you do, the absolute number of positive cases is certainly going to increase. And so I focus less on the absolute number and more on what they call the positivity rate. So what percentage of those that we test are testing positive? So I think that's more of an important number to follow. And so Kaweah Delta, again, since the start, it's hard to believe that it was back in early March that we collected our very first specimen. But we've collected 5,500 specimens since that very beginning. Roughly, say 560 of those that were tested positive. So we have a positivity rate, at least with respect to the testing that's been done by Kaweah Delta, of 10%. And so that's an important number. As any of you that have been following Governor Newsom's 4-phase plan for reopening the state, reopening counties and cities and other communities, one of the criteria that still is in place, and this is really to move into what they call the second phase of phase 2, is that you have to have a positivity rate of less than 8% for 7 consecutive days, the most recent 7 days. So obviously, we're running a little bit high on that metric at 10% versus being below 8%. But I think a lot of you know that it has been disproportionately affected by the significant breakouts that we've seen, not just in the nursing homes, but we had a very large outbreak in Reese Foods. I believe over 200 of their employees tested positive. The meat processing plants that you see in Hanford have had large breakouts. So our numbers really get kind of skewed because of those.
Okay. So why does our county not disclose the age range of the people who've passed away?
You know, our county actually did initially, and I would read it in the local paper almost every day. The county is consistently, pretty much on the front page of the Times-Delta, has been given a daily report. So we're at 73 deaths right now. The last time I recall them reporting the age of those that had died was when we were back at around 40 deaths. And they commented in their daily report that all 40 of those deaths were with people that were age 65 or older. So I don't know why I haven't seen any additional reporting. What I did look at is at the state level. So the state does report daily deaths by age. And I would imagine that, I mean, not to say that we're going to mirror the state exactly, but I think you'd find this interesting that of the 3,436 Californians have died of the COVID virus. None of them were less than age 17. 1% were age 18 to 34. 4% were age 35 to 49. 15% were age 50 to 64. 32% were 65 to 79, and 48% were 80 or older. So 80% of the almost 3,500 Californians that have died of the disease were 65 years or older, which I think is very similar to what we had previously been seeing from the county.
Right, okay. Can we compare how many people in our county died last year during this same time from the flu or pneumonia or other illnesses to what we're seeing now?
Yeah, I tried to research that. It's a great question because we're all very familiar with the flu, and we hear every year that tens of thousands of people across the United States and around the world die of the flu every year. So that information is readily available at the national level, not so available at the county level. I did go back, and again, I'll just give you the broad perspective. So the 2017, 2018, the flu, generally we start seeing it arrive in early September, and it kind of fades away in mid to late April. So that 2017 to 2018 was one of the most severe flu seasons that we'd seen in the last 10 years. Across the United States, there were over 79,000 deaths. In Tulare County, there were only 89. So we only had 89 flu-related deaths in that most severe flu season. Again, in the U.S., the next year, 2018, 2019, that number almost fell in half. We had a very light flu season. A little over 34,000 people across the country died. And then this year, the results aren't in entirely because, again, the flu season kind of just ended about a month ago. It's a pretty wide estimate that the CDC is giving, but they're saying anywhere from 24,000 to 62,000 U.S. Residents may have passed away from this most recent flu. I will tell you that at Kaweah Delta, it probably felt a little bit more on the mild side. I know that we saw almost 5,000 patients that came through Kaweah Delta tested positive. About 400 of them required hospitalization, but there were very few deaths.
Okay, thank you. So Aaron would like to know what our current capacity in Tulare County is to treat COVID patients.
So, yeah, that's a bit of an elusive number. Obviously, there are 3 hospitals in Tulare County. There's Kaweah Delta, Sierra View Medical Center in Porterville, and then Adventist Health Tulare in Tulare. Adventist Health Tulare made a decision very early on that they were not going to care for any COVID patients in their Tulare hospital. So any COVID patient that may have presented to the Tulare hospital was transferred to the Hanford Adventist Health Hospital. So I'm not certain I would consider Tulare's hospital to be in that mix. So it really is Kaweah Delta and Sierra View that are caring for the majority of the county. Right now, I can speak to the capacity of Kaweah Delta because, again, I don't know exactly what the capacity of Sierra View Hospital is. But within our medical center, we have 344 beds, excluding nursery, mother, baby, labor, and delivery. So those 344 beds are those that would be available to take care, say, of a COVID patient or really a patient with any kind of condition that required hospitalization. So of those 344 beds, 83 of them are currently open. A great deal of that is by design. So right now, our 11-bed Broderick Pavilion, which is normally a post-surgical unit, patients generally stay just a few days there. And our 12-bed pediatric unit, both of those units have been emptied. So they're sitting there empty, essentially just being available in the event that we should experience a resurgence or a second wave of the virus. So 83 beds that are available right now. Interestingly, that number has been declining over the last couple weeks as I think patients and community members are becoming maybe more or less anxious, less scared to the hospital, which has always been, it's been a huge concern of ours that, so many patients out there that still have chronic diseases and are suffering heart attacks and strokes and, asthma attacks, pneumonia, things of that nature. We really were not seeing those patients over the last several months, and it caused us great concern that they were going uncared for. I've talked to a physician in town here who told me he lost 4 patients who died at home from their chronic conditions that they were afraid to come in to his office or into the emergency department. So that appears to be changing. We now are seeing more and more patients coming in. Several of our units, like 4 South, 4 North, they're actually at 100% occupancy right now, again, without any COVID patients. So we do have capacity. I'm often asked, how about ventilators? And again, we really haven't had that many patients that required to be intubated throughout this pandemic. We own 96 ventilators. Right now, 29 are in use. Again, a few of them for COVID patients in the ICU, but mostly they're being used on patients with pneumonia, cardiac surgery patients, patients that are not able to breathe on their own. So that leaves us almost 70 ventilators that are available, that are in stock, ready to go, again, in the event that we would have a major resurgence.
Okay, thank you, Gary. Melissa, I think that answers your question about the ventilators. Another question that we have is, where the public can receive information as to the exact number of patients that have been admitted for COVID to the hospital from March until now. And so do you have that number, or is that more of a Tulare County?
Yeah, no, there is a website.
Okay.
I'll say it slowly. It's covid19.tularecounty.ca.gov. And that is a pretty recent website and dashboard that the county stood up in concert with the hospitals in the county, that we agreed that we would submit our daily information to them about number of hospitalized patients, about number of patients that were in the ICU, the number that were on ventilators, and so forth. So I don't know if they populate it every single day, but that website is operational now. I went to it earlier today. The one thing I was kind of disappointed that you don't see, which I think was the question, how many total patients have been hospitalized in the county since day one. So that's not in there, but there's a graph that shows you the daily occupancy. And again, it's really just the two hospitals, Sierra View and Kaweah Delta, but it has plotted back to the very beginning, back to early March, what the number of COVID positive patients are that are in the hospital, one of the two hospitals, on any given day. And you'll see that, as you would expect, it started ramping up over March and April. It appears that it pretty much has peaked at 40 patients. That's been the highest number of COVID positive patients that have been hospitalized on any given day since the pandemic began. Today, if you go to that website, there are 35 COVID positive patients that are in one of the two hospitals. So 35 total patients, 30 of them are at Kaweah Delta, which means 5 of them are at Sierra View. Just probably a couple weeks ago, maybe a week and a half ago, obviously we're in constant communication with our sister hospital, with Sierra View Hospital, which is a public hospital like us. Their COVID population had fallen off so dramatically. I think they were down to just having one patient in the hospital, and they were ready to dismantle, take down their command center and everything. And but then over a weekend, they saw a significant spike, and all of a sudden they went from having one patient to having 10 patients, and 8 of those patients had to be placed in the ICU, and a number of them had to be intubated. So it's obviously very fluid. I would say that it has kind of stabilized around this 30 to 35 number. So a lot of us think we're kind of plateauing right now, but obviously that plateau can change pretty significantly depending on our behaviors out there in the community.
Right. Okay, let's move on to testing. So John is asking if there's a timeline that the hospital hopes to meet in testing for COVID.
Yeah, I don't think we've actually set any timeline. It's a good question. I struggle to answer it because I think as long as we continue to observe people with the symptoms, and the symptoms have changed extensively over the beginning. Before it was just you had a cough, a fever, a runny nose, or a lower respiratory problem, difficulty breathing. That's expanded now to a sudden loss of taste or smell, fatigue, gastrointestinal issues, blue toes. So there's a lot of different symptoms that are being exhibited. And so we will probably continue to test as long as we see those symptoms. A lot of folks, including me, had hoped that with the arrival of the warm temperatures and everything that it pretty much fall off like the flu does. We don't see flu patients this time of year, and we don't test. If somebody comes in with a respiratory ailment that looks maybe like the flu in May or June or July, we don't test them for the flu. So for the flu, we actually have a date where we do stop testing. But this virus doesn't seem to be behaving that way. So we're going to continue to test, particularly a patient that needs to be hospitalized. So anybody that's going to be hospitalized that comes through the emergency department or some other avenue into the hospital, we need to test them because that helps us determine where we place them. Because again, we want to cohort any COVID positive or suspected positive. We want to put them on that 2 South unit, or so that we can protect other patients, protect our staff. Our staff know that this person is positive. So that's why it's important that we continue to test. We also started back up very, very slowly, deliberately, doing non-emergent elective surgeries, endoscopic procedures. We opened up our sleep disorder center, pulmonary rehab, cardiac rehab. Normally we don't test patients that are asymptomatic. We only test people that are exhibiting symptoms. But with respect to these new surgical patients, endoscopy patients, we are now testing every single one of them, whether they're symptomatic or asymptomatic. And so again, that's to understand what are the risks of this patient that we're, if you're having surgery, you're likely going to be intubated, you're going to be put under general anesthesia. That aerosolizes the virus, and so that creates a lot greater risk. So, and there's a lot of COVID positive folks out there that are purely, they're asymptomatic, but they still have the virus and they're still contagious. So because of just the added risk in doing those types of invasive procedures, we will continue to test all of them. So long answer to a question is like, there is no date yet.
Okay, John has a couple of more questions that probably have a similar answer, but are there timelines and goals established for each of the priority groups?
No, and again, when you speak of priority groups, definitely we have made healthcare workers, first responders have been given priority during the rollout of testing, largely because testing kits were very scarce initially. Kaweah Delta did not have the ability to do our own in-house testing. We could collect the specimens, but we had to send them to the county, to their laboratory to be tested. And so we had to be, just very cautious with how we were using the supplies, because we want to make certain that our employees, our physicians, our residents, those who are taking care of patients, we don't want to put patients at risk. So we needed to have the ability to prioritize them to be able to test them first. But as testing kits have become more and more plentiful, and we have two different testing platforms, one called BD Max, the other is the Abbott ID Now, both extremely sensitive, accurate, give us relatively quick results. Those testing supplies have become increasingly available. We have about 5,000 test kits across those two platforms. So we are starting obviously to use more now that we're testing surgical patients and endoscopic patients. But we also, if anybody is out there in the community and they're exhibiting symptoms, we refer them to either call the county to go through the screening process and they'll refer them to Kaweah Delta, or call your primary care physician. So a community physician can write an order to have their patient tested. They'll be sent over to the Kaweah Delta specimen collection site on Floral, and then we will run the test on our platform. So with the availability of greater testing, we're now expanding out more and more into the community.
Okay. So are people without symptoms being tested?
Not really, other than what I just described, that with the startup of non-emergent elective surgery and endoscopy, screening colonoscopies, things of that nature, that are invasive procedures, we are testing everyone, symptomatic or asymptomatic. But that's really the only category of people that we're testing that are asymptomatic. So everybody else, we're pretty much just testing those that have symptoms.
Okay, so Terry Ann wants to know if Kaweah Delta will ever provide a drive-through that you don't need a doctor or county referral.
I don't know if that's the case or not. So it's important to distinguish. There are two types of tests. There is what they call the PCR molecular test. That's the one I was just speaking about. That's when we go up into your nasal cavity. It's a very uncomfortable procedure. It's called a nasal pharyngeal swab, which is critically important. If you want to get a very valid test, you have to go deep up, really to the top of the nasal cavity. So that's the test we do to determine if you have COVID or not. But understand that it just tells us, if you're positive, that's pretty straightforward. We know you have it, and we need to determine, should you be quarantined at home now for 14 days, or do you need to be hospitalized? So that's pretty easy. If you test negative, it just means you're negative right then and there. You could be positive the next day. You could walk into the grocery store, you could attend a family event, you could do something and have an immediate exposure, and just because you tested negative the day before, it doesn't mean anything. It doesn't give you any real reassurance. And unfortunately what we're finding, this is a very crafty virus. We're seeing where, because there's an incubation period essentially, that you could have an exposure but not start showing symptoms and not test positive for the virus for anywhere from 2 to 5 days. So we're finding patients that we have tested negative, but they end up being positive, even though they quarantine themselves. They all of a sudden start exhibiting, worse symptoms, or but they're negative and then they become positive. So there's not a lot of reassurance. So I worry that if we just had a drive-by and everybody could come through and say, test me, I'm not certain what that accomplishes unless you have a positive. There's definitely value in having a positive. The other side of the testing is the antibody testing. And we now have that capability. We have 10,000 antibody tests in stock right now. It's a blood test, so they don't do the swab. We actually take a full test tube of blood, just like if you were having your annual physical and having blood drawn to test your cholesterol and so forth. There are many antibody tests out there, but we have purposely stayed away from them because we don't frankly trust, when you're just pricking the end of your finger and taking a little blood drop, we don't believe that that's going to provide you the same sensitivity and accuracy as we achieve on our immunochemistry analyzers. So we're going to start next Tuesday, first testing all of our employees, our physicians, our residents for the antibodies. And again, the antibodies indicate that you had the virus. At some point you had the virus. You could have been completely asymptomatic and never knew that you had the virus, but you'll have the antibodies. Or you did have the virus, you tested positive, you went through the symptoms, and you recovered at home or you recovered in the hospital. You're going to test positive for those antibodies. But all that does is tell you that at one time you had it. What we don't know is, does that give you any immunity whatsoever? Can I get it again? Or does it depend on the strength of the antibodies in your body? And our test will actually give you a number. It quantifies the presence, how much of the antibody is present. And you would think that the more antibodies that are present, maybe the more immunity you would have. But scientists have indicated, doctors have indicated, there's no assurance of immunity whatsoever. Can you get it again? Or if you do have immunity, how long will it last? So that's one of the great downsides to this is you test positive for the antibodies. It doesn't mean that I can stop wearing a mask. I can stop social distancing. I'm free. I'm risk-free. I don't have to worry about anything. Our employees have asked us the same thing. If I test positive for the antibodies, can I stop wearing a mask? And the answer is no. You need to keep wearing the mask. So we might do a drive-through antibody test. Again, doesn't provide really any value to that individual other than maybe satisfying our curiosities, but it will tell us a lot about the disease, about the virus in our community. How prevalent was it? What percentage of our population was asymptomatic? And so that's where the real value of the antibody tests lies, and I think that will probably be one area that we could look at a drive-through. You don't need an order. We want to collect data to study the broader population.
Okay. Is Kaweah Delta doing anything with contact tracing, or is that just the county?
It's just the county. I'm certain that we'll have Kaweah Delta folks that will volunteer. I know a number of our Foundation board members, folks that are involved in our community engagement initiative, have already come forward and said, "Hey, I'd like to volunteer and be part of that tracing program." But it's usually set up and run by the counties.
Okay, can you explain and share with us the prescription drugs that are being administered to COVID positive patients who are hospitalized?
Yeah, so we're there are not that many that are out there. I think everybody is familiar with hydroxychloroquine. That is a drug that was used to treat malaria, I think rheumatoid arthritis, lupus. It's something that's existed for decades, 60, 70 years. There are people that take that drug all the time for those different conditions I described. When it was first shown as promising for helping relieve the symptoms of patients that were really sick and that were intubated, for some, hydroxychloroquine really accelerated their recovery. We've heard some pretty remarkable miracle stories that have been experienced by folks that weren't expected to survive. And initially, they were asking us to use hydroxychloroquine along with zithromycin, a very common antibiotic, a Z-Pak we're all used to. So they were using those in combination, but then started observing a growing mortality rate for patients that were given that combination. So the CDC, the FDA, pretty much took the zithromycin out of the picture. So we still administer hydroxychloroquine to patients, not just in the ICU, but also those that are in 2 South. The most promising everybody's been listening to is remdesivir. So remdesivir is an antiviral. It's been developed it may have been developed as part of combating SARS-CoV-1. Where COVID-19, the technical name for it is SARS-CoV-2. So SARS-CoV-1 was a virus that many folks might remember a number of years ago. It kind of came and went, and also Ebola is another condition or virus that the remdesivir has shown effective. So remdesivir has been what's an experimental drug, not available to hospitals up until now. But the FDA and the government granted it emergency use classification just recently. So we did receive last week roughly 15 vials of remdesivir, which is about enough to treat 2 patients. But today we received 180 vials, which is enough to treat maybe 15 to 18 patients. We actually have already given remdesivir to 2 of our patients. The first patient, unfortunately, did not survive, was just too far along in the disease and probably was just given too late. I think we're hearing that remdesivir given more early on in the disease development might be more promising. So that will be a drug that we will be administering. And what we've seen in that drug is it can, again, accelerate the recovery. It can reduce the amount of time that somebody spends on a ventilator, which is really an important part of recovery. The longer you spend on a ventilator, the more difficult it is to fully recover. So remdesivir is showing a great deal of promise. We also have been administering antibody plasma. So you've probably heard about that again, patients that had the COVID virus, fully recovered, now have the antibodies in their immune system, and they donate their plasma, which is now rich in those antibodies, and we inject them into those COVID positive patients, again, generally those that are in critical care. I don't know offhand what the experience has been, but we have used it relatively extensively. And then, fever reducers, ibuprofen, Tylenol, IV fluids. A lot of patients are severely dehydrated, and then those, managing pain are the primary medications we use.
Okay, thank you. So Cynthia's asking, what actions and steps has Kaweah Delta put into place to ensure patients who come in for surgery don't get COVID?
So the first thing I mentioned is that we test every single patient. So 48 to 72 hours before their procedure, we do the PCR molecular test to determine if they have the virus or not. If they have the virus, we cancel the procedure and we reschedule it to a time when they're COVID-free. So that's the first thing we do to protect primarily, the staff and other patients that are in the hospital. But we also, we are constantly disinfecting. We also, if we have a patient that tests negative for the virus, but we're concerned that they could possibly still be at risk, we have a dedicated operating room that is just for those potential risks, where we take care of those patients there. Again, though, through the constant disinfecting, our staff, obviously we're trying to make certain that none of our staff are COVID positive. If any of our staff do exhibit symptoms or test positive, they're removed from the hospital, they're sent home to quarantine. So we make certain that the staff that are taking care of our patients are in fact COVID-free. They also exercise tremendous universal precautions. They use all of the personal protective equipment, the gloves, gowns, face shields, masks, again, doing everything to protect the patient from a possible exposure. There will always be risk. I have to be honest and say there's no absolute guarantee that that you wouldn't potentially be exposed. But I can tell you that I think the hospital is probably one of the safest places you could be right now. Just the way we just work in such a sanitary way, just the careful protocols and precautions we follow. I would be very comfortable myself having surgery here.
Okay. So Annan wants to know why Kaweah Delta is resuming services and prioritizing money over patient and staff safety. He's concerned that COVID cases in this county are just continuing to increase and that the hospital should be more cautious about resuming operations.
I don't disagree with him about being cautious and moving very slowly. I can assure you it is not about money. That's the last thing that motivated us to restart this. It's really about our concern about all those patients out there that I know the government and we had to characterize them as non-emergent, but we're talking about patients that have a torn rotator cuff. They have not a dislocated shoulder, but they're a knee, a hip. They're in a lot of pain, and they've been living with that pain. Their surgery was scheduled to have, and then it got postponed for 2.5, 3 months. So that really is what our motivation has been, is to take care of the healthcare needs of those patients. Now, we are exercising great caution. We have spent probably a month and a half planning how we would very carefully, deliberately start back, slowly with bringing more elective surgeries back on. So we just started on Monday, but for the most part, we're just doing outpatient surgery. So, the patients, they come into the ambulatory surgery area. Again, no visitors. So again, reducing exposure. But they come in, outpatient surgery, they recover, and they go home. And so we are doing a small amount of inpatient surgeries. In fact, we're limiting it to about 8 per day. So we did 8 on Monday, we did 8 on Tuesday. I don't know yet exactly what we did today. But the reason we're doing that is because we want to conserve beds. So the inpatients that we are doing are those that would just stay maybe 1 or 2 days. So that, again, preserving those beds. We also we're being very mindful that it's almost like a start-stop approach. We deliberately are saying, okay, here's day one. Let's, do our surgeries and then watch what's going on in the community. And so we're prepared if we do see a resurgence, if we do see a wave that occurs because of the loosening up of the stay-at-home, shelters, and we start opening up businesses, then we're quite prepared to pull it back, to say, okay, no more inpatient surgery, or we're going to curb outpatient surgery. So it's very easy to curb it back, to shut it back down. But if we don't see that resurgence, then we could potentially accelerate the opening up.
Right, okay. So Deborah, Jennifer, and Byron want to know your thoughts about the County Board of Supervisors' decision to move forward with reopening our county in spite of our County Health and Human Services and Governor Newsom's guidelines.
Yeah, it came as a surprise as much to me as it did all of you. I certainly wasn't consulted. The hospitals, I don't think, were necessarily involved in that decision. I don't think it was on the agenda, so it kind of came out of left field. I do know that the county very much, all of us, I think, were very disappointed when the governor came out with his revised Phase 2 guidelines and said that of the 58 counties in California, all but 5 qualified to move into Phase 2. Tulare County being one of the 5, Kings County being one of the 5 that were not permitted to move into Phase 2. And I think that angered a lot of people, frustrated a lot of people, because the reason that we're in that 5 is almost entirely due to the breakouts in the nursing homes, which are very contained facilities. It's not a reflection of just widespread community spread of the virus. And to simply have the governor just look at the numbers, look at the percentages, and ignore, the composition of that, I think really frustrated the county. And I know, this county is suffering. This community is suffering. There's so many people that are out of work, that businesses are closed. At Kaweah Delta, we're a business as well. And when you have to turn away 40% of your surgery customers, and you have to lay off staff and cut their hours, and we're like every other business in the community, we are allowed to stay open, to take care of emergent healthcare needs. But I really, I sympathize, I empathize with all those businesses and towns that have been just, devastated by this. So I understand the pressure that the county was under. So I kind of expected, I actually, earlier today, as part of one of the ways that a county can open up is if the public health officer attests that all of the conditions are present that would allow us to open up. And that means the hospital has to have surge capacity, which we do. The hospital has to have adequate personal protective equipment to be able to support a surge and all the demands that would have. So I prepared and sent a letter to the Board of Supervisors supporting Dr. Hott's attestation that we as a hospital were prepared to support a resurgence if the county opened up under Phase 2. I was surprised that the county, if I understand it right, its action was to move straight to Phase 3 and to skip over Phase 2. So I don't know, I don't have all the different phases memorized, but there's no doubt about it that it opens up more and more and more, allows more and more businesses, salons, restaurants, bars, things of that nature to open. Although the second phase of Phase 2 allows some of that to happen as well. But Phase 3, actually, I don't think the governor, what I was just reading, I don't think the governor has clearly defined the criteria for Phase 3 yet, and how that is so different than Phase 2. So I'm not going to criticize or judge the Board of Supervisors.
But are you concerned about the withholding of funding threat from the state that was issued to the county last night?
Yeah, I heard about that.
Make you a little nervous?
Certainly. Here just last week, I was pleading to the governor to provide $1 billion in funding for California hospitals between now and June 30th. California hospitals are losing about $20 billion a month because of the lost revenue. So I don't know what it accumulates to over this entire period, but here we're asking the state to support us. We're continuing to ask the federal government to support us. Congress is looking at potentially to provide hundreds of billions of dollars in funding to states and counties and local governments to help them, through the financial crisis that they've all experienced. And I believe that Tulare County had been allocated roughly $47 million of the money coming to the state. And I did hear that the governor's office sent kind of a nastygram to the county telling them that you are putting that funding at risk. So yeah, I am concerned about that. I am concerned that if we open up, my greatest concern, and I think this is everyone, is that our frustrations kind of get the best of us. And when we finally have this freedom and we open up, that we stop, our great behaviors that have really kept, other than the nursing homes, I think Tulare County has done a phenomenal job of keeping the hospitalizations down and the deaths down, and they're doing it through the social distancing and wearing masks and washing their hands and just exercising, really good behaviors. And I just fear that if the county jumps to phase 3 and they do open it up, that we as a society stop doing that. And so as the CEO of the hospital, my biggest concern is that, we do have this overwhelming surge that we've been able to avoid up to this point.
Right. So Phil wanted to know if you had been in contact with Devin Nunes or any senators to get them to sponsor the legislation to fund Kaweah Delta for its losses.
I now have Devin's personal cell phone number. He gave it to me. So, no, I've been in pretty frequent conversation with the congressman and his office. Kendra, who's his chief of staff or healthcare staff, they're constantly checking in with us. Also, earlier this week, we have a federal lobbyist group back in Washington, CJ Lake, and we're working very closely with them. I was actually selected by the California Hospital Association last week as one of the California hospitals that got to tell their story. So we did a statewide media conference with many newspapers, radio stations, television stations, myself representing Kaweah Delta, and Louis Ward, who represents 16-bed Mayor's Memorial Hospital up north. It's a district hospital like us, and obviously we're on two very ends of the spectrum. But we told our story, and their story was a sad one too. Mm-hmm. Only 16 beds, but they are the economy for their community. Mm-hmm. And they've been similarly devastated from a financial standpoint. So we spent all last week holding those conferences up and down the state, hoping the governor would be listening, the legislature would be listening. So we continue to put pressure on the state legislature and then also the federal government. Where $100 billion was allocated to U.S. hospitals in the CARES Act 3.0, the third one, the last one that was passed, and we're continuing to lobby for additional funding.
Okay, perfect. So we've got a few more questions, so
Okay.
we're going to fly through them. So why haven't the city and county leaders implemented mandatory masks when in public? Catherine has asked this, and now Lori has just asked this. Everywhere we go, people aren't wearing masks. So,
Yeah, and I think the city and county have been reluctant, to mandate that by the local government. I think they're leaving it up to businesses themselves, right or wrong. Kaweah Delta, a month and a half ago at least, when the CDC came out and recommended that everybody in society should be wearing a mask when they're out in stores and so forth, that was the recommendation by the CDC. Mm-hmm. And so when we started learning about such a high percentage of COVID positive patients were asymptomatic, meaning they had no idea that they even had it, but they were still contagious. We went to mandatory masking. So I only take my mask off when I'm on camera here, but as soon as I walk out of the room, I put it back on and I wear it every day. So I know that Lowe's has now mandated. Smart and Final grocery store has mandated. So there are a number of businesses that require, Costco, a few weeks ago started mandating that all customers wear a mask. And so the short answer is I think the city and county are kind of leaving it up to businesses to make those decisions.
Okay, so when is our lifestyle center going to reopen? Because according to Sue, that is an essential business for her.
I couldn't agree with her more. I feel so horribly out of shape right now. Yes, I'm an avid fan of the Lifestyle Center, and it killed me to close it. But as you can imagine, we're pretty jammed in there. I'm on the treadmill, and I got people just right and left, and a lot of them are going at it hard and spitting and coughing, and whenever you exert yourself, you're just gonna expel more stuff. So, and that's why I think the state. I believe gyms will be one of the last to reopen. But already, Patrick Tazio, our director, Jag Bath, our vice president over the Lifestyle Center, if you were to go by there, they're already moving equipment around. They're already creating the social distancing, the spacing. They're taking over conference rooms and moving equipment into there. So they're ready to flip the switch. When we get the green light from either the local government or the state government, we're ready to roll. I know that with the county's decision, we're carefully watching what other fitness centers do around the community, because I think the last thing that Jag and Patrick want to experience is everybody opens up, but Kaweah Delta keeps the Lifestyle Center closed. So it's going to depend.
Yeah.
But
Okay, so Maria and Kyra are both getting ready to deliver babies in the next few months.
congratulations.
But they really want to know if you foresee changing our labor and delivery visitor policy so that they can have family come and visit them when they have babies.
Unfortunately, I don't think so. I mean, we certainly want the father, the spouse, the significant loved one of that mom to be there with them during the delivery, and that's still permitted under our visitation policy. But just because the virus still exists, and just it's probably the most difficult thing we had to do during this pandemic is to adopt the no visitor policy. I mean, there are very few exceptions. If a patient is dying, if a patient's going to have a major traumatic surgery, neurosurgery, cardiac surgery, we do allow a loved one to be with them. And certainly the birth of a child, we want a loved one with them during that. But it's too great of a risk to bring families in that, again, many of them, they could be positive and just have no idea. They're just totally asymptomatic, but they're still contagious.
So is that the same for our hospital policy in general,
Yes.
visitors? Okay,
Yeah.
so that will
But
remain
we're continuing to evaluate it.
Right.
Again, when it makes sense, it may not, we may not lift the entire thing overnight. It may that we're, certain circumstances, we're going to gradually open it back up. But again, this is very fluid. We're making
Right.
decisions, based on the changing conditions.
So Gary's concerned about the diabetes educator at the clinic that is no longer there due to the COVID situation. So with the high population of diabetics in our county, is that position going to be brought back?
I don't know what clinic are they speaking of. Do you know? We have.
I can get more information from Gary.
I don't know if they're speaking with respect to Visalia medical clinic. They've had
Maybe chronic disease?
It could be chronic disease. Yeah, I think that's one I'll have to look into.
Okay. So one final question, Gary. So Mike wants to know, is the infection rate for nursing homes in Tulare County unusually high? And if so, why are the nursing homes in our area so vulnerable?
Well, I think we're discovering a lot about nursing homes across the country. We're hearing a lot about what happened in New York, that the nursing homes were pretty much ignored in the beginning. There was really no focus on them, and then we discovered that thousands of residents in New York nursing homes died during the early days of the pandemic. It is one of the populations that's been hardest hit across the entire nation. So I don't know if the nursing homes in Visalia are unique from that standpoint. I will tell you that nursing homes in general, I think, have been very unprepared for a pandemic like this. They don't maintain the personal protective equipment, that we have. They might have an infection prevention nurse that may come there once a week, once a month. We have a whole staff of infection prevention folks that's all they do. Dr. Dan Boken, our epidemiologist, on staff here, he's all about infection prevention. So I think we've learned a lot about nursing homes. They need to change significantly, without a doubt. It's very unfortunate. I think Redwood Springs was one that was hit the hardest and probably was the least prepared. Some of the other nursing homes have actually done a little bit better in Tulare County.
Okay, Gary, you know what? A couple of questions must have slipped past us earlier. Terry Ann is wanting to know if patient advocates are allowed to accompany patients.
So again, a patient advocate, if it's a patient with mental health disabilities that has difficulty being able to communicate directly with their caregiver, then they are definitely allowed to have an advocate. Any patient that normally has an advocate through our agencies here in town, absolutely, they're permitted to be with them. A child, we absolutely want to have a parent or an advocate with them while they're in the hospital. Any patient with a mental health condition, an advocate or loved one accompanies them as well.
Okay, what about service dog handlers?
I don't know the answer to that question.
Okay, so we will follow
Yeah.
up with you on that, Terry Ann. So
Are we on time?
we're a little
Oh,
bit
a little
over,
over,
Gary,
okay.
but
I apologize. I can be long-winded. So yeah, again, just my great appreciation and thanks to all of you for joining us tonight and just continuing to remain interested in Kaweah Delta. And as Deb said at the beginning of this, this has been one of the greatest initiatives that I think I've ever been involved in. It's just this much deeper engagement with our community and listening carefully and just answering all questions you have. We know some of the questions are going to be critical of us, and I think you learn more from criticism than you do from praise. So I definitely welcome that feedback. We want to be an outstanding hospital for you, but we know we always have opportunity for improvement. So never hesitate to reach out to us, to contact me, to contact Deb. We definitely want to hear about you, and I hope you're all staying positive and strong and healthy, and I wish you a very good night.
thank you so much, Gary.